We are performing an endoscopic laser-assisted rhizotomy in the lumbar spine, left L3-4, L4-5, L5-S1. Now, to treat 3 facet joints for pain with a rhizotomy, removing the nerve, the pain nerve that goes to those joints, is what our goal for the surgery is. And normally it's done with a needle called a radiofrequency ablation, but because this patient had that done and it didn't work, we decided to do an endoscopic procedure. And the endoscopic procedure will allow us to see the medial branch of the dorsal ramus, which is the nerve that we're going to be rhizotomizing or deadening that goes to the joint. Everything okay?
Yeah.
Floral. So right now we are at at L3, the L3 medial branch of the dorsal ramus, correct. We're going to bring the fluoro in, take a picture. Are you a little inferior? Oops.
Towards me.
Come on.
It's right there.
What do you mean?
No, it's right there.
Towards Patel, towards Patel. Go, go. A little more. All right, that's fine. Yeah, you're fine. All right, so you should be up against the, looks like the lateral wall of the facet there, right? Let me have the grabber.
Yes, sir.
Get the fluoro out. Give the laser to Patel. So Dr. Patel and I do these procedures together. And that looks like some branches there of the nerve. We're basically going to take down the soft tissues just lateral to the joint. Remember, stay away from the bone. You don't want to stick the laser in the bone and hit it because it's going to go right through the bone, the cortical bone. And then it's going to end up, you just move south a little bit. You just move south. I think you should go north because you just moved south. It's probably good. Feel right? You're on the TP? You want to stay in the transverse process? It's short bursts, and stop. It's about a second or two and then stop and relook. What I like to do, I like to start not inside but lower and hit it and sweep up. So you cut the soft tissues as you're pulling out. Does that make sense? So you want to try to avoid going down into a hole where you can't see. You don't need to pull your scope back, you just need to pull your laser fiber back. Yeah, we're not seeing. That might be one of the nerve right there. It's hard to see. Let me see, you're right on the TP, right?
Yeah.
Come on out. Just keep the laser. Right there, you think that's it? I gotta get closer to see what I'm doing. Bring your scope down. Yeah, you can't go so high up. Otherwise we can't see. Closer. What's that in the middle? Alright. Is that bone? What's that in the middle? See it? Is that some schmutz?
Yeah.
Take your scope out, hold the thing, don't let it come up. Yeah, it was just some schmutz. Can I try? For a minute? I got it. Alright, so I like to come in and feel the bone. I'm sliding off, so I don't know if I'm sliding in the foramen. That feels like TP right there. You see how I angle a little bit and kind of burn it back. To me, that looks like bone. That's going to be your superior facet. And then your transverse process right here. And this nerve should be running right through here, right? See, that's TP, right? Mammillary process, almost. And you feel we're right on the TP and facet here. Right there. Let's get a shot. I'm gonna hold it right there.
Can I read with the laser?
No, leave it.
Leave it?
Come. Stop and shot. That looks pretty good, right? Out. Yeah, so we're right where we need to be. And I can't get it to 12 o'clock. That's a little better. That feels like TP there, right? Think we got it? Huh?
Yeah, I'm sure.
Because that's our lateral of the facet, I believe. And this is out on the TP. So, I mean, we're in the sulcus there, the valley, and I don't see a nerve. I think we got it. It's just nicer when you actually see the nerve itself, and you know for sure. That may be a piece of it there, right up against the bone. These things are really hard to get with a needle. That's why the needle doesn't work so well. You know?
You see so much soft tissue.
Yeah, there's so much soft
I
tissue.
never expected to see so much
Right?
soft tissues there. I thought like probably clean.
For what?
I think it's probably like a clean view when you go
Yeah.
down, but it's so much tissue.
Yeah. Oh, it's surprising just how much soft tissue there is around the facet joint. But I don't see any more branches. And that's got to be the facet joint, right? The lateral. So I think this one's done. You want to take it out? Take it out. Go ahead and do an injection.
Come off, please. Please first and then second.
So that's one medial branch of the dorsal ramus done. And that would be the what, L3 dorsal ramus? L3 medial branch.
We have the pressure.
Pressure. So we're going to take the tube out and put some pressure so that stops any venous bleeding in the muscle. We'll hold that pressure for a minute.
I need a towel, please.
What's your head? What's your head?
On the floor. Thank you. Thank you. Picture.
Shot. I didn't see a shot. Oh, there. Why do I have a hard time seeing the TP? Is that it? Just a little lower than you?
Right there.
You think we're overexposed?
If you wanna calm it a little bit. Yeah.
See the needle tip? What's just below that? That little wing there. Is that the TP or what is that?
Yeah, that's part of TP. Can you get this off? Lower?
Alright. You're happy with that?
That's it.
So can you guys see the x-ray? Look at where the needle tip is. That's where the nerve is. The nerve usually runs right across that spot. So we're going to go down there with the scope and try to find it and then transect it using the laser. Transection in medicine means to cut through it. So it's a cable that's sending, whoa, why is it, oh, you got it out. It's a cable that is sending bad information. And that bad information is pain information. So we don't want, the patient doesn't want those pain signals going from the facet joint up to the brain. So we want to end the transmission of pain signals up. And that's what this procedure does. So the positioning is just lateral to the pedicle. The pedicle is that circle you could see right next to the needle on the right of it. Monica, can you, I guess you're busy there, never mind. Just show the circle, the pedicle that's right next to the needle. It's like a circle, like a clock face.
If you wanna leave it there and then.
Are you using the mouse? There you go. Yeah, that's it right there. That circle right there. That's the pedicle. So the transverse process is to the side of the pedicle. We call it lateral to the pedicle, and that's where we are right now. So we've just made an incision. We're going to bring this dilator down, and the dilator will go all the way down to that spot. Bigger knife. Which way do you cut? This way? Just a little light. Let's see, shot. I want to make sure that hasn't moved. Shot. Keep going. All right, so we're right at the sulcus. Is that what it's called, the sulcus buttock? Right between the pedicle, which the superior facet is right there, and the transverse process. It's a juncture of three things: transverse process, superior facet, and the pars interarticularis, and the pedicle. So that's where the pedicle is, the junction of the superior facet, transverse process, and pars interarticularis. So it's really three things come together there, and that's why we're here, because this is where that pain nerve runs. It's good? You happy with it? Hold on.
Just push back so that it doesn't stay.
Yeah, it's a soft tissue. Shot. Maybe a little more medial.
Non.
Right there. Should be good. I can feel it. All right, let's get the scope in.
Scope on, please.
Fluoro out. Scope on, fluoro out. Give me the grabber.
Yes, sir.
Watch it, the laser fibers there. All right, go, Patel. Don't bend it, don't bend it. It's got to go straight in. If it's not straight, it won't go in.
More north, there you go.
Okay, pull back a little bit. Is that the nerve there at the bottom? See it? That's just fat. A lot of fat. That's transverse process. So I get in there and just start zapping all that. Can you do that with a laser? Go.
Okay. You ready?
I pull back just about, there you go, right there. It's perfect right there. And just get in and just start
You ready?
getting that. So you can see there's a lot of fat and soft tissues in there. And that's why the rhizotomy RFA doesn't work. Because there's all that tissue there that's just taking the electricity and the temperature at the tip and just dispersing it. There you go. See what I mean by that? You kind of pull back. You go down and don't go through the bone, but you pull back, and that allows you to stay out of the bone, but still strip the soft tissues and nerve. All right, good, 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 good. Wait. Let's go back down and look. Okay. Where do you think the nerve is? I think it may be, can you feel the TP? All right, so get all that stuff right there at 3 o'clock, yeah. Mm-hmm. Nice. Don't keep going in the same place. Bring your scope down. You got to see what you're doing. Let's see there. Hold on. Wait, where is this? Wait. Yeah, right there. Don't go in the bone. You're inside the bone. Stay on the surface of the bone. No, you're going in. You got to get closer with that camera. You're pulling back too far. You got to stop and we got to see. Just try to get all that soft tissue there. That's just fat. Hold on. Okay, this should be it there. Some capsule probably, right? Grab her. Let me get the fat out of there. Go ahead, Bada. She's clenching up. I'm trying to figure out why. Is that bone right there? That looks like bone.
Deep there.
But what about right there? No? All right, go ahead. Take them. Maybe just her movement. That's bone. Yeah, that is bone.
So TP is here.
Yeah, strip all that stuff. Strip all that stuff off. You just basically want to cut through that soft tissue that's on top of the bone. Okay, let me try. Let me try a little bit. All right. Let's not let this come out too much. Let's get a X-ray. Coker. Go. In. Good. Shot. Why am I not seeing it? I need to see it over there. No, that should be X-ray. Keep that on X-ray over there. That wall over there should be X-ray. No, it works.
Let's tilt. Maybe tilt.
Tilt.
Propeller tilt. Great.
Shot.
That's good.
So we're good, right? All right. Pull out. Laser. That, see that right there? That looks like the nerve. You see that? Like,
3 o'clock.
yeah, right here. Well, let's see. So what I'm doing is basically just stripping the soft tissues off the lateral aspect. And these things that are in the way, you got to get them. Otherwise, you're never going to get the surgery done. You just have to do it. There's nothing around the facet joint that's that important in this patient, except for the nerve root. It's the only thing you want to make sure you leave alone. And there's an artery too, a little foraminal artery. If you can just avoid injuring that, that's always good. Remember, we see it all the time in the fusions. I'm not able to move this laser where I want it. That's better. Okay. Still struggling here. We're gonna have to do another fluoro shot. Yep. With this is moved. Come on. South. You think? Monica, you got to come in with the same angle. Shot, you got to give us the same shot every time. It's got to be the right shot. You're too far south. Again. You're blurred. Again. You were moving when you took the shot. Just take another one. What do you think, Patel? Looks... I mean, we're right where we're supposed to be, right? Yeah. It's all this tissue. It's all fat around the facet. Huh?
See all these fat bubbles coming.
Mm-hmm. Yeah, but I'm not happy about it. Huh? But do we have irrigation? The fuck is this thing not done right? Yeah, the funny thing is when the irrigation stops, it stops. But that's what I... Yeah, but it's not going to come out. Let's take this out. Let me have the grabber. Yeah, that's the problem, Luis. You keep pulling your hand back, and it pulls my tip away from 12 o'clock where I want it.
It's better there?
Yeah, it's better. This is all just fat and scar tissue around the joint. I'm not able to roll it to go side to side. I don't know why.
Are you using higher or lower intensity compared to the disc for the laser?
Lower.
Lower?
Now, where are we at? Like 10?
20.
20?
20 watts compared to 30 watts that usually we do on the for lumbars.
Yeah.
You want a 30?
No, no. No, the biggest problem is keeping this thing where it's supposed to be.
It keeps sliding.
It keeps sliding. We need to get another x-ray.
Down the middle.
A little
No.
come towards us. That's good.
That looks good.
Yeah.
All right, out. That's it right there. All right, laser.
It's inside.
Just say inside. I'm not able to roll the laser. It's not rolling at all. I would let go of it. It's not moving. This has to be free. It cannot be trapped. Otherwise, it's not going to move where I want it to go.
I'm gonna leave it free.
There's something wrong with the way we're managing the laser. Come on. You got to figure that out, Luis. I don't have the time to figure that out. You got to figure out why it's not moving properly. It's just fat, 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 you know? No wonder why rhizotomies don't, RFAs don't work. There's so much fat down here around these joints. Huh? That looks like bone. Right? That's got to be the TP. God damn, this thing. Just terrible. Just doesn't stay put. We need to get another fluoro. This fucking thing just moves around. Shot. Reliable there, yes. All right, out. And there's the bone. There's so much time wasted in repositioning, you know? It's incredible. Incredible amount of time wasted just wiggling around. I just don't see any more nerve. Was that her moving?
No, I don't think.
Hmm?
I don't think she's moving.
Well, something just tightened up. I think it's her.
If you feel it, yeah.
Huh?
If you feel it, yeah, then
Yeah.
it's good.
You didn't feel it?
No, no.
Why is there a lake down here?
That was my fault. At the beginning of the case, I was the irrigation, right? Leave it open. That was my fault.
It's still leaking, I don't know. I think it's just the way
It's the problem.
yeah. I have like 50 towels under the bed, but it's like so much I don't think I can.
Let's get the fluoro in again.
Monica.
Damn.
It's not coming from like one spot though, so I can't really like collect it or anything.
Let's, never mind, I found it. We're here, yeah.
It's
Laser. The problem is every time I try to roll the laser, it's not rolling. So then I have to move the scope to get the laser repositioned. And that's causing everything to shift. We pretty much obliterated her transverse process. Let's see where we are. Shot. So what do you think about that? Too high? Damn it. Why is that coming off? Shot. Too low. Shot.
Very shortcut, that's why.
Move your hand. Shot. Okay, good. Why is the light source coming off? That shouldn't come off.
I need to push.
Huh?
I need to
Fluoro out.
That's fine. Push, yeah.
It's not a push-in thing, Luis. There's something else wrong.
Can I have another light camera, please? No, another camera and light, please.
Is this supposed to
Yeah.
screw on?
Another camera and light, yes.
Why? This doesn't screw on normally, it just pops in.
Yeah, so what happened is, looks like I went twisted, get loose a little bit.
Yeah,
Thank
but
you.
it,
Yes, thank you.
do you understand what I'm saying?
Yes, sir.
It's supposed to slide on.
I know, sir, but with the movement, like, get loose, and then that's what happened in this case.
Let me see that laser. You know, what'd be helpful is some way to anchor it into the bone at the TP right here. You know? kind of a pain in the ass to do. Come on, come on, come on, come on, come on, come on. You can't see, you're not in the position. Well, you gotta see. All right, go south.
Picture.
All right, out. So it comes back to the same spot. We can see the bone. That is gotta be the TP. The only question is when I try to get more medial, I just can't. Probably because the facet joint is pushing me. Louise, I cannot get this. See, it keeps popping out. I gotta get this laser fiber more towards the 12 o'clock position. Anything you can do to help me do that? It's just sitting mid scope. Grab her. How's the sound, guys, on the broadcast?
It's good, Doc.
Nice. All right, we're done here. There's not much else I can do there.
Stop off, please. Thank you.
You need to turn it on. That's good. Oh, we have two more.
Come on in.
Pressure, put pressure. I don't want an intramuscular hematoma. Otherwise, they have pain and they don't know why. And it lasts months. Why did you take a picture? His hand is there.
Come towards me. More tilt. Come south. See the transverse pressure L4 is like so short and slanting down.
Mm-hmm. Abnormal.
Same for here. Picture. Picture.
So now we're aiming for the transverse process where it meets the pedicle superior facet of L5 on the left. You feel it? Feel bone?
Getting bigger?
Check the position. Shot. It's good. can see the superior facet, pretty arthritic.
Picture. Picture. Picture.
You feel it. Let go. Coker. Shot. Shot.
It's super articular process.
Well, it slid right off. Shot. Yeah. No, I see it. Shot. But it's like sliding off. I think that's pretty good. Shot. That looks good. Let's get the scope in.
Yeah, yeah.
Okay. You're in too far. You're in too far.
Lights off, please. Thank you.
Right. Go on. All right, let me in. You feel her tightening? Hmm? You feel that? Huh? No, it's just her Parkinson's. Gotta get this thing over there. Grab her. All right, do you think we're still in the right place? It feels like it. Don't go down. Feels like it. Can we get a shot? Just way too much fat in there. Shot. It's not bad, right? Okay, out.
Thank you.
This grabber is honestly too long. Okay, you gotta get closer. I gotta get closer, closer, closer. There. I need to see what I'm actually zapping. That may be the nerve right there. Let's go to 12 o'clock. This wire is just not going to 12 o'clock. I cannot get it. You've got to bring it like this, okay? I want to see down here. You got to get closer. Keep moving. It's really disorienting me. All right. That's got to be the superior process, right? Fucking hell. Can't get anything with this goddamn wire, Luis. Maybe you can just move it to me in a way. Okay? But where you're, come down. But where you're holding it is not helping. Let's get the fluoro back in.
Monica, please. Thank you.
In. Shot. Nope. It's not too bad. Are you going to take another shot? No, move it. It's not, your angle determines what we see. If you're in the wrong place, it's not good for us. What do you think? It's not bad. All right, out. Where is all this fat coming from? So we're not here to get the fat. We're here to get the nerve that's going to the joint, which is buried in the fat. It's like almost impossible to see. You gotta get closer. Towards me. Towards me. Mm-hmm. I'm not able to get this to 12 o'clock. I just don't understand why we cannot get it to 12 o'clock. There's not the design of this thing. There, that's 12 o'clock. All right, I gotta take control of this because you're holding it too still, and you gotta have to move it around in order to move the whole rig. Let go of the cable. Mm-hmm.
Can you separate a little bit?
See the grabber?
Yes, sir.
Are we on the TP there? Feels like it. All right, let's see where we are.
It's starting the irrigation bed.
Is that it?
That's it.
Yeah, we moved too far medial, right? Shot? No.
One more level here after this.
What I'm saying is that I'm asking if we're in the right spot. Does that make sense? Oh, I'm just explaining to him.
Want me to come out?
No. Shot? You can come out.
Out? Watch your legs, Louise.
Yes.
I think that's lateral. I mean, that's bone. That's. That's facet. SAP, I agree. Just not. I don't know if TP is here. It's a weird TP, huh?
Very short and very slanted.
It's an abnormal transverse process. That almost looks like root. See, that looks like that artery we always hit when we go lateral, you know what I mean? It's amazing. Well, let's see where we are. Come on in. Watch out, Luis. Come on in, come on in. Further, 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 stop. Shot. Too lateral. Shot. Shot. Still, right? I mean, just on the lateral. There it is. Shot. It's too medial. Shot. How did that come out?
Uh-oh. No, no, no. It is okay.
No, leave it alone. Leave it alone. It's off the field.
Yeah, it is.
Here. You're closer. You can turn that one in.
Shot. The fat is really our biggest problem in doing these. Shot. That's pretty much it, huh? Right there. Wouldn't you agree? On the x-ray? Shot.
Please help me.
See, it's so easy to get off.
Yeah.
You know?
Ready?
That's the problem. Shot. Especially when you have abnormal anatomy.
Like, do we have another one for next case ready?
Yeah, yeah, yeah. Okay. We're fine.
Leave that.
Keep going, keep going, keep going. Alright, ready? Alright, ready?
Feel bone.
Are we staying or come out?
We'll tell you what we want. Shot. Can actually see the bone there. Right? Just beyond that. Get it out. It's good. It's right there. Oh, that just slipped down again. There. Don't worry about that, Luis. Just give me the fiber. Let me drop that. It's taking too long for you to try to grab it.
Not a problem.
Okay? I think that's about all we can do here.
Lights on, please. Thank you. Scope off, please. Thank you.
Scope, fluoroscope in.
Thank you. Yeah.
Let me know when you're ready. Shot. Go ahead, Patel. Hmm. Oh, it looks really good. Is this dull? Shot. 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 Hmm. Shot. Shot. Too medial? Or is it okay? Huh? There? They're slipping into something there. It feels like I'm here. Feel it. Lateral shot.
Short. Sleeping from the wall. Like it's a vertical process and you're sleeping in the thing. I think that's good.
Let's try that.
Picture. Picture.
Scope.
Scope on.
Scope on. Go on. Scope on.
Watch your left, boy.
Yeah.
Thank you.
And that looks like muscle around the joint. What do you think?
Yeah. Go a little lateral.
Just not, it's just doesn't feel right. Bring the fluoro in.
You want this?
Shot. Is that it?
Yes.
2 lateral.
Two north.
Shot. 2 south. Shot. Looks good. Out.
Legs, legs.
The problem is anchoring it here. You know?
Slant.
You take the scope. Bring it down. Maybe underneath the soft tissue here. Yeah, there's something about the way that this scope works that it doesn't allow me to move the fiber like I should be able to. I'm having to stick my finger inside this hole, and that's just not good. There's bone there. See it? Right there. It's missing now. I want to go more. Bring the scope.
Floor. Yeah.
Think that's it? Let's see. Shot. Shot. It's just, you're just not showing it to us.
Picture.
You gotta change the angle, come on. That has nothing to do with it. It's not about collimating it. It's about changing the damn angle. You got to show us the tip of the scope. Are you looking at the fluoro? Do you see the tip of the scope? There you go. I mean, that looks like it's in good position, right? Huh? You can see the bone out. Huh?
Like 5 o'clock, you can see.
That's hard bone. Somehow we're losing our access to the bone. I don't know where we are, do you? Let's get another fluoro. Fluoro out. Come on. You got to be quick. It's just taking too long. You got to be, once we're ready and I start grabbing the thing, you got to move out. We have a small window where we can work. It's not like Duke laser disc repair. The bone is here. I want to get to 3 o'clock. Yeah. I think that's about all we can do. I don't know what else to. No, we're done. We're done. We're done with fluoro.
The pressure.
Go ahead. No, it's all right. Yeah. Just do like a little steri strip and a little pressure bandage. How did the sound work out, guys? Still working? Chat? We'll call our EBO 5 mil. You have a pen?
They're on your mail stand with the benzoin. You're welcome. Careful, it's wet. Don't slip and break your other foot. Do you want me to grab your shoe cover now?
Hmm?
Coming back February 1st.
Full time.
We have next week with us.
Full time, hey.
Is Dr. Underscore?
He will be our full-time anesthesiologist. So how do you think we can